Hello, my name is Mariana Stoica and my student ID number is N41382681. Today I would like to discuss about contemporary issue in health and social care. The health and social care sector in the UKA could be viewed as embracing the many modern day challenges that might impact the improvements in the level of services, continuing impacts from COVID-19, ramification of Brexit regarding workforce and supplies, the changing of social media in health communication, and continuing trends towards medicalization. This presentation comprised an in-depth discussion of these issues, an analysis of the critical perspective that will be lent to care delivery, and an hypothesis of potential outcomes. The UKA health and social care sectors houses a range of services directed at the promotion of good health and the general well-being of people. This sector comprises the NHS, social care services, and independent healthcare providers. The total planned budget for 2024-2025 in the NHS sector is about 179 billions, which is one of the highest. The budget covers medical treatments, preventive care for health, mental health services, elderly care, and services for vulnerable groups in NHS hospital. It faces issues like an aging population, constraints in terms of budget, and changing healthcare needs. There are a lot of contemporary issues that the UK health and care social care sector facing at the present. The COVID-19 pandemic has exposed all system vulnerabilities, putting the resources on staff under unprecedented stress. Challenges overstaffing, supply line disruption, and regulatory control changes have cropped due to Brexit, which affects services delivery. Regarding public health communication, social media has become a double-edged sword between practical information, dissemination, and misinformation. Concerns are also brought to the forefront regarding a trend of medicalization that has to do with reliance on medical intervention for social or lifestyle problems. Conforming to this imperative of needs, innovative approaches and reforms are incumbent to ensure that quality care remains accessible and sustainable to all citizens. Post-COVID-19 issue faced by the health and care sector of the UK. We have staff shortage. According to Young 2023, almost 43,000 vacancies needs to be filled in NHS as COVID lead to a staffing shortage. Long waiting period. The current waiting time for elective procedures or treatments is 14.5 weeks. Mental health crisis. One in six people aged over 16 has some mental health referral. Increased costs. NHS faced an increase of 5 to 6 billion in COVID-related expenses. Delayed treatments. Cancer treatments are delayed by 8-10 weeks due to a long waiting list. Burnout. One of third of NHS staff report burnout due to overworked. Telehealth surge. Virtual consultation have increased by 70%. People are more used to telehealth services. NHS Mercy Care 2023. Impact of Brexit on health and social care in the UK. Staff shortage. Over 330,000 UN nationals have been lost from the NHS workforce since 2016. Recruitment challenges. 10% of vacancies rate for nursing position. Supply chain disruption. Increased costs and delays, with 60% of medicine previously imported from the EU. Regulatory changes. 500 million estimated cost for adapting to the new regulatory standards. Research and funding. The UK lost access to many funding options due to Brexit, which affect medical research, medicines and equipment, delays in approval and disruption affected many pharmaceutical imports. Training and education. Reduced opportunities for medical students due to changes in the Erasmus Plus program for health and care workers. Social media has influenced the UK health and social care sector negatively. The positive attributes of social media include platforms through which information concerning health and public health campaign can reach millions of people at a go. For example, during the COVID-19, it was a favorite medium for vaccination and health guidelines. Health professionals use these platforms to network, develop professionally, and share good practices. However, social media also comes with disadvantages. Dissemination of disinformation and health myths leads to public distrust concerning medical advice and vaccines. For instance, the spread of misinformation on vaccine relating COVID-19 resulted in hesitancy towards the vaccine within certain groups of people. The following serious problems are privacy concerns and possible breach of patient confidentiality. Areas of improvements founded due to this issue. Workforce management. This involves developing an improved recruitment and retention strategy to prevent staff gaps. This includes targeted international recruitment and improved working conditions to avoid burnout. Supply chain resilience needs to develop strong supply chains, reduced reliance on a single market, and localized medical supply production. Physiological support. There is a need to increase mental health related services and integrate them into some primary care to help reduce the burgeoning mental crisis by ensuring that people get support when and where they need it quickly. Digital health integration. This should include investments in teletech infrastructural and working training to help sustain the surge in virtual consultation, making care even more convenient and efficient. Impact of this contemporary issue on overall care delivery in the UKA. The current issue that challenge this sector in shaping the health and well-being of society in the UK are mostly related to how care is delivered. Staff shortage due to Brexit and the COVID-19 pandemic tends to overworking available services providers, increase workloads and extending waiting time, possibly reducing the quality of care. Failures in the supply chain for medical goods can directly affect the quality of rendered treatments and its outcome for the patient. The rise in mental health problems puts additional pressure on already overstrained support system and lowers the capacity to react promptly. Vaccine hesitancy emanates from the spread of misinformation through social media and undermines public trust in healthcare advice. Both complicate public health. All this make over treatment and exaggerate medical intervention, diverting resources from clear priorities of preventive and holistic care approaches. These challenges call for systemic changes, innovative solutions, and sustained investments, guaranteeing that the effectiveness of care delivery comes through with lowers comes through with universal access and equality for all UK residences. Hypothesis of potential outcomes to minimize services disruption. This issue have several potential outcomes. Solving them according to the guidelines below can greatly decrease services disruptions. Increased recruitment and retention approaches. Implement targeted recruitment campaigns internationally and domestically. Improve the working condition, salary, and career development opportunities for staff. Offer psychosocial and resilient training of health workers to reduce burnout. Robust supply chain management. Broaden the sources of supply and increase local production to reduce reliance on foreign markets. Create strategic reserves of critical medical supplies. Integrate mental health services. Enhance mental health services and integrate them into primary care. Add funding which translate into resources for mental health support and preventive care. Improved public health communication. Implements the most rigorous fact-checking and counter misinformation campaigns on social media. Also discuss with trusted community leaders to establish trust and disseminate proper health information. Digital health expansion. Invest more in telehealth infrastructure and the training of health workers. Ensure access to digital health services for all population. Regulatory adoption and innovation. Make regulatory systems leaner to accommodate post-Brexit challenges. Encourage innovation and collaboration in health research and development. In conclusion, several historical and contemporary challenges are testing the health, social and social care sector of the UK. Part of this environment is being regarded as particularly contemporary given the knock-on effects of COVID-19, Brexit, social media influence, and the trend towards medicalization. Dealing with this will involve the targeted recruitment and retention strategies, strong management of its supply chain, integrated mental health services, effective public health communication, and expansion of digital health. These measures help the sector reduce disruptions, improve service delivery, and provide high quality and accessible care to all citizens. The changes should be continuous based on innovation if the labyrinth of challenges is to be navigated, created robust plans to deliver a resilient future healthcare system. Thank you very much and I wish you a good day. Thank you.